Good afternoon. My name is David Bright, and I'm on the board of the SATB2 Gene Foundation, here today to present the Spring 2023 update for the Research Roundtable. The SATB2 Gene Foundation has been around since 2018 with a mission to enrich the lives of individuals with SATB2-associated syndrome, including those diagnosed with the condition and their families. We do that through three key aims: support, research, and education. Our organizational strategic plan points to all three of those, with research being a key part of that. You can view the full strategic plan on our website, and we'll provide these slides after the presentation for the direct links as well. The research that we currently support and have supported in the past is highlighted on the website, as well as funding opportunities. Each fall, we generally release an RFP, and the dollar amount reflects fundraising for that year. We've recently been in the $25,000 to $50,000 per year range, meaning in the first 5 years of the SATB2 Gene Foundation, we've been fortunate enough to fund 7 projects for a combined total of well over $100,000. And we look forward to supporting additional research in the future. Aside from the grant funding, the Foundation has also supported the development of iPSCs. So if you're looking for iPSCs for your research, there's an application and an MTA available at our website. We only charge the cost of shipping, so the cells are otherwise free for research purposes. And we have several different cell lines with details of each of those cell lines on our website. If there's any other way that we can support research, whether that's collaboration, connection, whatever that would look like, please reach out to us at research@sat2gene.org. We'd love to discuss opportunities for sharing and collaboration towards our collective goals. As a nonprofit organization in the U.S. that raises money for research, we wanted to be sure that we were focusing resources in areas of greatest value and not simply towards research that the current foundation board found interesting. In order to establish a defensible research strategic plan, we began a collaboration with Odylia Therapeutics to produce an independent assessment of the research landscape. The board was able to combine Odilia's report with a survey of SATB2 families to develop a research strategic plan for the foundation. Both Odilia's report and our research strategic plan are publicly available on our website, and we are very open to feedback and conversation as we evaluate and update the strategic plan over time.
Hello, my name is Catherine Post-Amont, and I am a scientist with Odylia Therapeutics. Odylia Therapeutics is a nonprofit biotech, and our goal is to transform drug development for rare diseases. In that goal, we partner with rare disease advocacy groups such as the SATB2 Gene Foundation to provide scientific strategy, risk mitigation, and operational guidance. As David said, in 2021, we partnered with the SATB2 Gene Foundation to provide a strategic plan for their organization moving forward. Our goal with the strategic plan was to provide concrete recommendations to the Foundation about how to best direct their research efforts. To this end, we reviewed published literature and public databases, we interviewed with clinicians, researchers, and family members, and we integrated these learnings with learnings from related fields and diseases with consideration given to the operational priorities of the Foundation. So to best do this, we provided a syndrome overview, a highlight of research priorities and key biological questions, an identification of available resources and tools, as well as recommendations on what to develop next. So after reviewing all this information, we were able to identify and highlight scientific gaps present at the time of publication. Now, unfortunately, we don't have time to go over all of these now, but a few examples include: what are the effects of the specific gene mutations? Are they resulting in a haploinsufficiency, or is there a novel deleterious function, or a potentially dominant negative function? Additionally, what is the function of SATB2 over time, specifically postnatally? We also identified that further research needed to be done to look at aspects of the disease that might be interconnected. For example, are the behavioral symptoms connected to the sleep disturbances? Additionally, details on seizure types, the genesis of the seizures, and if these seizures are contributing to sleep disruptions. A key area that we identified as something that needs further development was research tools, specifically antibodies, fully characterized patient-derived iPSC cells, and increased patient and family data collection. Finally, we also wanted to highlight the biggest immediate needs of the community, which included research to identify therapies and treatments for the sleep difficulties, behavioral issues, and the speech and language deficits. The important next step in this process was taking all the scientific gaps into consideration and generating a strategic path forward. By helping to prioritize and organize efforts of the Foundation, we can aid in the development of treatments and make sure fundraising dollars are spent where they are needed most. This translational expertise allowed the SATB2 Foundation to refine their strategic plan for success. Thank you for your attention. As David mentioned before, this strategic plan can be found at the SATB2 Gene Foundation website. I have attached a link here as well as emails to get in contact with both the SATB2 Gene Foundation as well as myself.